Hi, my name is Maani Aghahoseini. I'm a fourth-year medical student from the Hull York Medical School. Thank you very much for having me present at this conference today. The presentation I'll be giving is titled Abdominal Wall Reconstruction, the Significance of Preoperative Rehabilitation on Post-Operative Success. So, as you know, abdominal wall reconstruction comes with a number of complications, including recurrence and surgical site infection. These complications can actually be reduced in terms of the type of surgery that you do, so component separation, Botox, or progressive preoperative pneumoperitoneum. But very little even research is done on preoperative preparations that can be done to improve the postoperative success in this major surgery. So the aim of my literature review was actually to identify these optimal parameters needed in four major preoperative modifiable risk factors, which would improve or optimize postoperative outcomes when it comes to abdominal wall reconstruction. So to identify papers that would be needed, I did a PubMed search from its inception to 2020. And as you can see in the bottom left there, it sort of details this process. I started with about 65 papers, but ended up with about 25 papers that underwent a full text review. The four modifiable risk factors that I investigated are listed in Table 1 there. Is obesity, malnutrition, poor glycemic control, and smoking. So looking at obese patients, as you can see in Table 1, there's a significant increase in SSIs and recurrence. But what was found was that an effective and sustained weight loss was achieved when it was done with about 0.5 to 0.7 kilograms per week over a 6-month period. And the most effective measure was a modified fast high protein diet, which was self-graded with an individualized plan that was regularly reviewed with a dietitian with an emphasis on face-to-face contact. And with this method, actually, the majority of the patients kept the weight off that they had lost post-operatively for up to 18 months. In terms of smoking, the complications and problems associated with smoking are well versed. But what's shown here is that actually, if the patient actually underwent a 4 weeks of smoking cessation, all of the risks actually reduced to that of a non-smoker. Nicotine replacement therapy was the most effective way of doing this, but also effective communication as well. Some patients, they said that if they were told about the certain high levels of mortality or the, significant risk of recurrence, that is associated with smoking, it would actually encourage them more to quit or reduce the amount that they smoke. For glycemic control, keeping the glucose levels of about 80 to 110 milligrams per deciliter in non-diabetic patients and below 140 in diabetic patients. And finally, coming to nutrition, a tenfold increase in infection is actually seen in patients with low albumin, and a greater mortality is reported in patients with low arginine and methionine. Optimal results are achieved when 5 days prior to surgery, a preoperative supplementation of omega-3 and arginine is given to the patient, and this helps lower a length of stay for the patients and reduces mortality. And finally, the post-operative protein goals of about 1.5 to 2.5 grams per kilogram should be prioritized for optimal preservation of muscle mass.